It's a series of small injections. Usually it's not painful, it's just a slight sting, but it's over very quickly. Unfortunately, the bruxism treatment is not permanent. However, we have noticed there is an improvement over time in your symptoms generally, and the treatment seems to last longer every time you have it as well. The masseter muscles, the ones that are injected with Botox, can reduce in size slightly. However, this won't have an impact on the jawline particularly, apart from it can soften the jawline. That can be a side effect. However, we try to inject the masseter muscle, the muscle that we're trying to soften, in a way that we try and minimize those side effects. The jawline doesn't look more saggy. There are plenty of tissues just above the muscle which support the skin, so we haven't noticed that is a problem. If it's done in the correct hands, it's safe. However, there are side effects and complications which we will discuss with our patients when they go through the process. Unfortunately, you can't have bruxism treatment if you're pregnant or breastfeeding or have any neurological problems, which we'll discuss before you have any treatment. Risks are usually minimal and include bleeding, bruising, mild swelling initially, and there is a very small chance of infection. There can be some weakness with the jaw muscle, but again, this is rare. Most patients who have bruxism or teeth grinding have usually seen their GP or their dentist for the problem. Sometimes they're prescribed painkillers or mild sedation, and sometimes the dentist has prescribed them plates to be used at night time. These unfortunately can be ineffective, so Botox has been found to be a great alternative for bruxism.